Hi, my name is Libby Jo Kimson, and I will be going over my public issue today and a few different situations that have made me become an educated citizen here at Methodist College. So, for my public issue, I chose to discuss the relationship between stress and cortisol. Most people are unaware of the relationship between stress and cortisol. According to Susan Harris, a University of Nebraska extension educator, these are the 5 different levels of stress: physical, emotional, behavioral, cognitive, and self worth. The University of Nebraska Medical Center states that cortisol is a natural stress hormone produced by the human body when we experience emotions such as fear, anxiety, or anger. Continuous levels of high cortisol can affect blood pressure, immune system, and are even linked to anxiety and depression. Stress and cortisol play a huge role in mental health. I chose this topic because I have never been very good at handling stress, and I also have been diagnosed with anxiety and depression. Major stressors in my life are school, work, and family issues. This increased stress really impacts my mental health. I have considered getting my cortisol levels tested because of the following symptoms I've experienced that are related to high cortisol. Symptoms like disturbed sleep, mood changes, fatigue, brain fog, bloating, and hair loss. This is what spiked my interest to research the relationship between stress and cortisol. My first topic as an effective communicator occurred during my first semester at Nebraska Methodist. I was enrolled in Nurse 447, Collaborative Leadership and Management in Nursing. During this class, we had to do an assignment that required us to interview someone in a leadership position. I chose to interview one of the supervisors at my hospital that I work for. Communicating my questions clearly and concisely was extremely important, as well as maintaining good eye contact and making the interviewee feel comfortable. Throughout my interview, the supervisor mentioned many times how important communication is in nursing. I understood how important it was, but it was interesting to understand the extent of communication importance in a leadership position as well. Effective communicator includes not only just communication, but the setting and the environment of conversations, verbal and nonverbal communication, and especially in a medical setting, cutting out the jargon, explaining things to patients or other people on a level that they understand, not using words that they don't understand because they aren't in the medical profession. So the impact on my social issue, we need to get the word out. Communication and getting the word out there about the evidence linked between the relationship between stress and cortisol is super important. Being able to explain the relationship of these things together helps those who do not have medical experience understand the significance of this issue. My second effective communicator topic was when I was recently promoted to a leadership position in the ICU. I was recently promoted to what they call a team leader, or what others may consider as the charge nurse. I was worried about this position because I didn't know if I was ready to take this next step. I was a new grad. I had only been there for a year. I didn't know if I was confident in myself. My boss sat me down and explained that she was confident in my abilities and to care for patients, communicate with the rest of the care team, and to be in this leadership role. During our discussion, I realized that my communication and leadership skills were noticed by others and a lot stronger than what I had originally thought. Others may see and notice your growth before you do. Communication is a huge part of being a leader. This includes communication with fellow staff, doctors, patients, other leaders, and family members. I now understand that others see the ability of my communication skills. I have gained confidence in communication, which can help me spread information about my specific social issue. I can make a larger impact even if it's just one conversation at a time. Next are my experiences as a reflective individual. My first story talks about when I was caring for a patient in the hospital that had been experiencing some cognitive changes. We've run every test in the book, we couldn't find an answer. Due to her cognitive changes, she was getting agitated and confused. Medication wasn't helping, nothing was helping. So I chose to take the time out of my shift to just sit down with her and talk with her, get her mind off what was going on, and it started to calm her down. Just a simple conversation. I stayed late after my shift had ended and made sure that she felt comfortable with the nurses that were coming on. And looking back on this, I reflected and realized that this was a moment that I was more than just a nurse. I was a safe person for this patient and her family. I was someone they could trust and rely on. The biggest takeaways from this were I learned that being a nurse is more than just the exams, vitals, and medications. I learned that my biggest strengths as a nurse are compassion and thinking outside the box. Nursing is more than just anatomy and physiology. It's an art. So, with my social issue, being a well-rounded nurse can be very impactful to those dealing with stress. Showing compassion and figuring out how to help others with these issues is so important as a role as a nurse. My second reflective individual has to deal with a pediatric trauma. As an ICU nurse, I am required to respond to all the codes and traumas that occur in the hospital. One day a trauma red was called overhead and I responded to the ER. Emotions were high because we knew that it involved 2 pediatric patients. But it was important to focus on the task at hand, saving these girls' lives. After the trauma was over, the other nurses and I did a lot of reflecting. What could have went well, what did go well, what could have gone better. While reflecting, we all felt a lot of emotions. Some of the other nurses and I shared a hug and shed a few tears. It's important to allow yourself to feel these emotions after the situation. If we bottle up these feelings, we will have a difficult time regulating our emotions. Being vulnerable is okay. And I learned that vulnerability is a strength. Taking time to reflect is an important part of healing, and asking for help is okay. It's important to relieve your stress in a healthy way. Bottling those things up just causes us to suffer more from stress and keeps increasing that cortisol level. Allowing yourself to reflect can help relieve some of that stress. Moving forward, let's discuss my change agent stories. As a new grad in the ICU, I experienced many critical scenarios that most nurses that were experienced had never seen. The first few months on the job were very challenging. One particular situation was a code blue of a woman in her 20s. This was a really difficult case for me because she was so close to my own age. I realized that life can take a turn for the worst when you least expect it. I worked hard to advocate for my patient and even for myself after the traumatic event. Because of my advocacy, a debriefing was held for all of those who were involved in the case. As a new grad nurse, I never thought I would know so much and learn even more during my first few weeks of orientation. I did not think that I would be so confident in myself to step into positions that really forced me outside my comfort zone. It's really important to recognize that when I'm confident in my own abilities, it makes me a great, passionate, and competent nurse. It's still okay to ask questions because sometimes things and outcomes are definitely still unknown in nursing. It's super important with my social issue to create a voice for those who are unable or unsure. Helping spread knowledge of the relationship between stress and cortisol will help those who do not know how to get help or are unsure of what questions or who to ask. It is important to spread communication, reflect, and work to change ideals that have not previously been talked about or challenged. My final change agent story has to deal with the class that I was currently involved in this semester, Nurse 478C, Population-Centered Health. So we were put to the task of completing an individual project that focused on a population near us. For my project, I chose to focus on vaping in my local public school. Vaping is a huge, huge issue, especially in the younger population. As a change agent, I want to push boundaries and create change for these important topics. By stepping up and advocating for change, I can help create an environment in a school where my future kids might attend. I learned that even if you are not directly tied to an issue, you can push to create change. If you believe you have reached your full potential, you haven't pushed hard enough. There's always room for growth and learning, no matter where you are, no matter how old you are, no matter who you are. I have experienced high stress situations and have been looking at getting my cortisol levels tested. I may not be directly impacted by this relationship, but I'm still able to educate and advocate for those who are. I will continue to push boundaries and create change for topics that I view as important, even past this particular issue. So, throughout my short but impactful 3 semesters here at Methodist, I have become an educated citizen by becoming an effective communicator, a reflective individual, and a change agent. I will continue to use these skills that I have learned to continue to make an impact on my current social issue as well as those future issues that I continue to be passionate about. Thank you for viewing my presentation today. It's a very important topic to me, and I hope that you find it important as well and you are able to learn from it. Reach out if you have any further questions. Thanks.